The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of thousands of participating companies, only the top 4 in each category are selected as finalists.
Imagine you are a pediatric cardiologist seeing a new patient with an incidental diagnosis of atrial septal aneurysm. You wonder about the need for anticoagulation for such a patient and read the literature to find that there is limited evidence on how to manage such a case. How do you proceed with the care of this patient? Physicians often face such uncertain situations for many reasons, such as a study answering the question has not been done yet, the available evidence is unreliable, or the evidence does not apply to their patient. In such situations, wouldn't it be amazing if physicians could leverage the experience of millions of past patient encounters instead of relying on anecdotal experiences or input from colleagues? The prognostogram makes it possible to aggregate data from millions of patient charts and obtain a summary of what happened in practice. To provide our service, we first clean up the data present in the electronic health record. Then, using a novel search engine, we generate patient cohorts in seconds and perform statistical analyses to provide an answer for your clinical question within hours. Ordering a prognostogram only requires a few minutes and can be done through your EMR or from our online portal. Once we receive your question, we will work with you to refine the question, perform the suitable analysis, and to provide an interpretation of what the results mean for your patient. Our clinicians will discuss and clarify any follow-up questions.
Hear in their own words why they should win.
Hi, I'm Brigham Hyde. I'm one of the co-founders and CEO of Atropos Health. We have a solution that presents a real-world evidence platform that enables point-of-care use of real-world data by physicians and patients. And excited to tell you about our entry today and a little bit about what we're up to. The solution that we've created is meant to solve a problem we call the evidence gap. And to describe this evidence gap, I have a chart here, but essentially it's the idea that most clinical decisions are based on evidence from clinical trials in the form of guidelines and publications, but most clinical trials exclude the majority of patients. Our solution looks like this. We call it the Atropos Evidence Platform, and that platform enables what we call the green button informatics console that serves physicians at the point of care. The way it works is a physician requests or asks a question to our platform, and we will within 24 hours turn around a report called a prognostogram answering that question. Second element of our platform is our library or portal, where there are thousands of such questions that have already been run available for those who want to ask questions or look for similar research. Then lastly, our platform connects to many relevant data sets, both specialty and national data sets, so we can match the question asked to the right data set to answer it. Here's how that process works. Through our app or through your EMR, you type in a question, a few sentences is all we need. It's received by the informatics team on our side, who then will input that into our technology platform called ACE. That system will turn around a report called a prognostogram in under 24 hours. And speed is the superpower here. Individual prognosticograms like the one you saw have gone on to be published just on their own merits as observational research and enter the literature and even the guidelines. There's also a significant element of health equity to what we do, being able to actually tailor answers to the details of the patient.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.